Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Today I have another important topic, which is uterine artery pseudoaneurysm. Why important? Because it can cause horrible uterine bleeding and it can be life-threatening condition. So, we need to know about it. What are the objectives? What is the definition of uterine artery pseudoaneurysm? The histology, the pathophysiology, the epidemiology, etiology, types of uterine artery pseudoaneurysm, clinical presentation, diagnosis, and treatment. Let us start with the definition. What is a pseudoaneurysm? Pseudoaneurysm is an extraluminal collection of blood with turbulent flow that communicates with the parent vessel through a defect in the arterial wall. This is pseudoaneurysm. And this pseudoaneurysm happened in uterine artery. Here, look to this picture. This is the pseudoaneurysm. Okay? An extraluminal collection of blood with turbulent flow that communicate with the parent vessel, as you see here, through a defect in the arterial wall. Okay? Uterine artery pseudoaneurysm is a complication of pelvic surgery. I can count many obstetric trauma and the gynecologic trauma, obstetric trauma like cesarean section, okay, like manual removal of the placenta, like instrumental delivery, and the gynecologic trauma like DNC, like myomectomy, hysteroscopic surgery, and so on. So, it is a complication of pelvic surgery, either obstetric or gynecologic trauma, or it may happen also after vaginal delivery or abortion. It is usually detected after the rupture of the pseudoaneurysm, thereby manifesting as a massive hemorrhage. That's why it is very important to be diagnosed as soon as possible and managed properly. Histologically, uterine artery pseudoaneurysm often consists of only one layer of loose connective tissue, which differentiate them from true aneurysm, consisting of complete three-layered wall. We know that the wall of the artery formed of three layers. So true aneurysm contain three layers in its wall, but pseudoaneurysm contain only one loose connective tissue, one layer of loose connective tissue. Okay? Extraluminal turbulent blood flow can lead to enlargement of uterine artery pseudoaneurysm, making it susceptible to rupture and subsequent bleeding. Please look to this picture. This is the uterine artery. Traumatic injury happened here in the uterine artery. Then pseudoaneurysm developed here. Then the pseudoaneurysm rupture causing horrible uterine bleeding if it is connected to the uterine cavity. If it is not connected to the uterine cavity, it is outside the uterine cavity, it can cause hemoperitoneum and may cause hydronephrosis. So the pathophysiology starts, as I said, with injury of the uterine wall during cesarean section, during DNC operation, during manual removal of the placenta, any traumatic obstetric or gynecologic trauma or procedure, IUD insertion, can cause injury to the wall of the uterine artery. Okay? Then the blood dissects into the periarterial tissue after the injury and they create perfused sac, which communicate with the artery lumen If the blood is fully covered by the adventitia or surrounding tissue, a pseudoaneurysm is formed. Then blood fills that sac during systole and flows away during diastole. The uterine artery pseudoaneurysm rarely reach more than 30 mm in diameter. What about the epidemiology? Is it common or rare condition? It is rare, but potentially life-threatening lesions. That's why it is important. So, uterine artery pseudoaneurysm are rare and potentially life-threatening lesions. Their actual prevalence rate remains unknown. The uterine artery pseudoaneurysms may occur after using an intrauterine device, traumatic delivery, pregnancy termination, cesarean section, manual removal of the placenta, forceps delivery, vacuum extraction, or dilatation in the curettage. So, what is the etiology? Uterine trauma due to obstetric causes, cesarean section, forceps delivery, manual removal of the placenta, vacuum delivery, or gynecologic procedure like dilatation of the curettage, hysteroscopy, myomectomy, and so on. Also may occur secondary to non-traumatic delivery or abortion. So, may it happen after vaginal delivery? Yeah, it can happen. Or after abortion? Yeah, it can happen. What are the types? As I mentioned before, this uterine artery pseudoaneurysm may communicate with the uterine cavity, causing abnormal or severe or horrible uterine bleeding, or maybe non-communicating with uterine cavity, resulting in hematoma formation outside the uterus, which may cause also hydronephrosis, and the patient may be shocked, and surgery should be done immediately. The clinical presentation of such a condition vary, may be asymptomatic because it is not ruptured, this aneurysm not ruptured, or maybe mild symptoms like pelvic pain, but still non-ruptured, but may be manifesting with life-threatening horrible uterine bleeding or hemoperitoneuria if this pseudoaneurysm ruptures. What about the diagnosis? Radiological diagnosis is very important. First, transvaginal ultrasound, as in this picture, especially associated with color Doppler, is very important in diagnosis. As you see here, this is uterine artery pseudoaneurysm, have a characteristic sonographic appearance manifesting as pulsating anechoic or hypoechoic structure connected to the parent artery by thin vascular neck. So hypoechoic or anechoic structure connected to the parent artery by thin vascular neck. As you see, this is the longitudinal view. This is the pseudoaneurysm. This is transverse view, the same, but in transverse view, and this is with color Doppler. Spectral Doppler presents turbulent arterial blood flow with to and fro pattern in uterine artery pseudoaneurysm. Okay? What else in imaging? Magnetic resonance imaging, revealing an enhanced pseudoaneurysmal sac-like structure within the uterus. What is next in imaging? Computed tomography angiography. As in this picture, this is angiography. and this is the left uterine artery, and this is the pseudoaneurysm, how it looks. So computed tomography angiography confirming the presence of uterine artery pseudoaneurysm with a narrow connection with the parent artery, which is the uterine artery. Angiography is considered a gold standard for the confirmation of uterine vascular lesions. And if you remember my lecture, my previous lecture, when I talked about arteriovenous malformation, I said also angiography is a gold standard, and angiography is used as a diagnostic and a therapeutic by doing uterine artery embolization and the closure of this vessel. So also, as it happens in arteriovenous malformation, as I said in the previous lecture, embolization after angiography, I can use angiography as a diagnostic and a therapeutic also in uterine artery pseudoaneurysm. So what is the differential diagnosis? The most important, as I said, the other abnormality or malformation, as I said in the previous lecture, the congenital and acquired arteriovenous malformation. So I should differentiate between uterine artery pseudoaneurysm and congenital or acquired arteriovenous malformation. I can differentiate via color Doppler ultrasound, MRI, and angiography. Okay? Okay. And both of them can be treated with uterine artery embolization. What about the prognosis? Uterine artery pseudoaneurysm are rare but potentially life-threatening lesion. Lack of timely diagnosis of uterine artery pseudoaneurysm can lead to incorrect management and poor outcomes. So all obstetricians should be aware, and the gynecologist should be aware of such a problem, can predict it, can diagnose it by imaging. If the patient presented with rupture aneurysm, should be managed properly, okay, because it is a life-threatening condition. The patient may be presented in by secondary postpartum hemorrhage, one of the causes of secondary postpartum hemorrhage, uterine artery pseudoaneurysm. And the differential diagnosis also is arteriovenous malformation. Also may be presented with heavy or profuse menstrual bleeding. The patient may come in shock, hypotension and tachycardia, okay, up to death if not diagnosed and managed properly. So let us go to the treatment. The first line treatment is transarterial embolization. Has been widely used for the management of uterine artery pseudoaneurysm in recent years. Arterial embolization, being a fertility preserving treatment, is a method of choice in the management of such a lesion. Embolization of the uterine arteries is an effective and safe way of controlling the clinical symptoms of uterine artery pseudoaneurysm in centers experienced in intravascular therapy. Of course, we are dealing with such a condition as a teamwork with interventional radiology. What are the other lines of treatment? Hysterectomy. Yeah, hysterectomy is recommended especially for postmenopausal patients with uterine artery pseudoaneurysm. Laparoscopic treatment methods are reported rarely. During laparoscopy, what we are going to do, we can close the feeding vessel or remove the pathological tissue, okay, via laparoscopy. This is the end of my lecture. I hope it was clear enough, and I hope you see the other lecture about uterine artery arteriovenous malformation, because uterine artery pseudoaneurysm and uterine arteriovenous malformation fell in differential diagnosis, and both of them can cause abnormal uterine bleeding, heavy menstrual bleeding, life-threatening condition of bleeding, or secondary postpartum hemorrhage. So you should know about them, although they are rare, but still important, and you should diagnose them early and manage the patient properly. Thank you, everybody. This is my scientific site, my site on Amazon, and this is my 6th book published on Amazon: textbook of obstetrics, textbook of gynecology, contraception handbook, multiple choice question book, medical disorder in pregnancy, and the gynecologic oncology book. My site on YouTube here in this link, and my site on Blogspot here in this link. Wishing you all